Good morning. I'd like to welcome everybody to the second panel of today's webinar, where we'll be discussing pay for play. Before we kick off the panel, I'd like to turn things over to Beth Finkel, the State Director of AARP New York. Beth?
Good morning. Thank you, everyone, for being here. Thank you, Greg, for hosting. And thank you, Assemblymember Gallagher and Senator Fernandez, for being such great champions of this work. So thank you. Americans pay some of the world's highest prices for prescription drugs. And one of the major reasons is that our medications are so expensive are the arrangements that big pharmaceutical companies enter into with generic drug manufacturers to delay the introduction of generic drugs. This is what's known as pay to delay deals, which are really rather egregious. These agreements entail name brand drug manufacturers. They compensate the generic drug manufacturers to keep their products off the market for a certain amount of time, which means that the average consumer is now precluded from getting a more reasonable way to get their drugs. The brand name companies benefits by able to sell their drugs at a higher cost for a longer amount of time, while the generic drug makers also make money because they get compensated for keeping their product off the market. And that is an agreed upon length of time between the generic producer and the brand name producer. And who loses in the long run? It's the consumer. It's you and me. The only ones who are not benefiting are, and then we end up paying that higher generic drug when it hits. We pay the higher cost until the lower price generic drug finally hits the market, and we could be waiting quite a while for that. This is particularly hard on older New Yorkers who tend to need multiple medications for their health. And far too many of them then have to make that terrible decision of putting food on the table, paying for their drugs, paying for their housing, or maybe even cutting their prescription drugs in half, which is really terrible. And that's why AARP is here today supporting this legislation, which is sponsored by Senator Fernandez and Assemblymember Gallagher. If enacted, the Manufacturer Disclosure and Transparency Act would require prescription drug manufacturers to notify the state attorney general of arrangements that have been made between the pharmaceutical manufacturers, resulting in the delay of the introduction of these generic drugs. This would be a major step toward bringing down the skyrocketing costs of prescription drugs right here in New York State. The use of generics instead of brand name drug products has been recognized as a critical and compelling approach to controlling the high rising costs of drugs. In fact, generic drugs have exactly the same active ingredients as the brand name drugs. But get this, they cost as much as 85% less. Generic drugs are 85% less. So why are we paying the higher costs? And thankfully, we have these great legislators who are here to put a stop to it. So studies show that expanded generic drug benefits were associated with reduced prescription costs, decreased number of physician visits, and total healthcare costs. So I'm looking forward to joining the panel and hearing what they have to say on this issue. So thank you again, all of you, for joining us today.
Thank you, Beth. My name is Greg Salisbury. I'm an editor with City and State. I'll be moderating today's panel. The members of today's panel are State Senator Natalia Fernandez, representing the 34th District in the Bronx and Westchester. She's the chair of the Alcoholism and Substance Use Disorders Committee. And as Beth mentioned, she's the sponsor of the Senate bill on pay for delay. We also have Assemblymember Emily Gallagher, representing District 50 in the North Brooklyn neighborhoods of Greenpoint and Williamsburg, who is sponsoring the assembly portion of that. And we also have Professor Michael Carrier, the Board of Governors professor at Rutgers Law School, and he's the co-director of the Rutgers Institute for Information Policy and Law. And finally, we have Lee Purvis. She is the prescription drug policy principal at the AARP Policy Institute. And she's the prescription drug policy principal in AARP's PPI, where she heads their work on prescription drug issues. And without further ado, let's get started. Professor Carrier, I was wondering if you could provide us with an overview of how pay for delay became a way of doing business today? How is it legal? How the courts weighed in on it?
Sure. So thank you so much. And thank you to City and State and AARP for bringing us together. Thank you to Senator Fernandez and Assemblymember Gallagher for your leadership on this vital issue. Why does this happen? Well, go back to patent litigation. A brand company oftentimes sues a generic for patent infringement. It says that the generic is infringing its patent. Most of the time, those cases settle, and those settlements do not present concern. Why? Because they're based on the strength of the patent. The brand firm is able to keep the generic out based on its patent. And so if it settles in allowing the generic to enter the market before the end of the patent term, that is fine. The problem is when the brand firm pays money or something else on top of that, because in that case, the brand is getting more delay than it is entitled to based on the strength of its patent. So just to make it more concrete, imagine that I'm a brand firm and here we are today in 2025. My patent lasts until 2035. You're the generic, and you and I both think that there's a 50% likelihood that the patent is valid and infringed. Based on that, you'd expect generic entry in 5 years, in 2030. Imagine now that I give you $100 million to delay entry from 2030 until 2032. Those 2 years of delay are not justified based on the patent. Those 2 years of delay are a problem. And so that is the antitrust concern. Nonetheless, courts historically had difficulty with this. Why? Because there's a patent involved. And when there's a patent involved, courts say, or they used to say, that it's completely fine. You have a right to exclude. 2005 to 2012, all the appellate courts said this was fine because it fell within the scope of the patent or as a settlement, and settlements are a good thing. 2013, the Supreme Court, in a case called FTC v. Activists, said that this could violate antitrust law. And so after that decision, we saw the number of pay-for-delay settlements go down quite a bit. Now the issues are more nuanced. It's no longer a bag of cash. Rather, it is hidden in certain types of services or certain promises that the brand firms are making. Tough to put a finger on exactly where the value is, but it still is taking place. And there still are nuanced and complex cases going on in the courts. Sometimes courts find that this is not a problem, and that's why the legislation that is sponsored and that we're talking about today is so important.
Okay, thank you. Lee, what has this meant for consumers, especially the older Americans that AARP represents?
Thank you so much for having me. Unfortunately, the short answer is nothing good. I think everyone who is listening right now is aware that prescription drugs are expensive, but sometimes I think it gets a little bit lost exactly how expensive they have gotten. The median cost for annual treatment for new drugs that came on the market last year was $350,000. So that just makes it even more important to get those less expensive generics on the market as soon as possible. And as Beth mentioned, people that AARP represents use more prescription drugs than any other segment of the population. It's on average about 4 or 5 prescriptions per month. And as she also mentions, it's Office for Chronic Conditions. So when AARP is talking about people who are facing high prescription drug costs, we aren't talking about people who are facing a one-time expense. This is often something that they'll be facing every single year for the rest of their life. And they also don't have the resources to absorb those costs. The median income for Medicare beneficiaries is around $36,000 per year, and 1 in 10 have no savings or in debt. So they really just do not have the capacity to absorb the costs that are being driven by prescription drugs. So when we talk about all of this, that's why these pay-for-delay agreements are so important and so egregious, because when we're talking about these expensive drugs, any delay in access to those less expensive generics can be hugely problematic. And that's when we start hearing about these people who are having to make those tough decisions between paying for the prescription drugs they need and paying for other really important things like their food or their rent. And the other thing that's important to keep in mind is this is just not for the people who are taking those drugs. Healthcare premiums that people are paying are being driven by insurers who are having to pay for these more expensive prescription drugs for longer than necessary. So the reality is these agreements really are problematic for consumers and taxpayers on a number of different levels, and that's why it's so important to address them.
Thank you. Assemblymember Gallagher, I'd like to turn it over to you now. If you could provide us with some more background on the legislation that you're sponsoring, the goal of it, and what we can look forward to.
Absolutely. So, as you've really laid out, Lee and Michael, this is a critical issue for consumers in New York State and for all of our people in New York State. And so, I really believe that transparency is the best sword that we can use to begin to cut through so many of these issues where, let's be real, consumers are being absolutely hosed by these corporations so that people can profit. It's not because these are expensive drugs to manufacture. It's not because of the cost of the manufacturing. It's not because of anything except for a profit motive. So this bill, and Senator Fernandez actually has two pay for delay bills. The bill I carry with her is a transparency bill. So it will let the consumer know that this product has been delayed for generic consumption. And I think that will help to enlighten the consumers about what's going on, about this long time scheme to create profit off of our ailments and our illnesses. And it will also help to drive the discussion in sunlight. So it's really important that we're bringing these conversations out into the public, especially at a time when the federal government is absolutely gutting our consumer advocacy groups. Like we've seen 40% cuts in the FTC, which is a critical partner in this kind of work. So this bill is saying transparency is key. It doesn't really do more than that, but I think it's a good first step. And I do want to put a little plug in that the best way that we will bring down costs for every single person is by passing the New York Health Act, which is, universal health care.
Sunshine is the best disinfectant in this case. Senator, I was hoping that you could expand on that about this is the first step and you have a bill that would be the second step.
Yes, thank you so much. And thank you to my colleague in the Assembly, Member Gallagher, for her partnership on this, because this is a big first step, creating that transparency and letting us see what's going on. If we see what's going on, we can report it, we can build up the information, the facts that we have. So then when we go into litigation, we know what's going on and we can find trends. We can stop them as they begin to grow even more. But my bill is the next bill is a little different, and take it as, our way of really trying to, stop the increasing of drug pricing and really bring better options to New Yorkers, especially to our seniors, because as we've said many times here, they're struggling with these payments and being able to just live their lives knowing that they got to make a decision over one thing to another. So the other bill, to clarify, does not, because some people have said this bans the whole process. It doesn't ban it, but it bans the agreement between generics and brand names, because currently the presumption is that the pay for delay agreements are not anti-competitive in nature. So unless it comes to courts, they can decide if it is competitive and was delaying for wrong reasons, unfair reasons. This bill flips the presumption, meaning that the pay for delay are presumed to be anti-competitive if the generic receives anything of value from the brand name with the promise that they will delay launching a generic version, and if the generic agrees to limit or forego research, development, manufacturing, marketing, and the sale of the drug over a period of time. So these agreements between the generic brands and the big brands that have pro-competitive benefits, where the pro-competitive benefit outweighs the anti-competitive effect, those are allowed. So that's why the transparency is needed, because in those cases, if the pro-competitive benefits outweigh anti-competitive, we can still see the the good and the bad of it.
Thank you. Before we move on to the next round of questions, I did want to remind the audience that if you would like to add a question into the question and answer portion, we will get to that if time allows. Next, I'd like to ask the panel, this is open to everybody. We've been talking about state level work. What do you expect and or hope for at the federal level for tackling pay for delay? Specifically, what can we expect from the Federal Trade Commission, which has been involved in this for the past number of years? And what does a bipartisan bill that's moving through the US Senate addressing pay for delay, what does that mean for your efforts?
Yeah, so I can start. So in the courts, I'm a little worried. I think that as we move from cash to more nuanced agreements, I'm not sure the courts are always going to recognize it if it doesn't take the exact form that the Supreme Court analyzed in its decision, then the courts might not see the anti-competitive harm. The makeup of the US Supreme Court has changed from the time of 2013, so I'm not optimistic if a case like activist gets to the Supreme Court again. In terms of the FTC, I do worry that its resources are lower than they were before. One of the benefits is that healthcare does seem to be a bipartisan issue. I could see the FTC continuing to carry the laboring oar on part of pay for delay. But again, they have other things going on, and so there's no guarantee of that. And then finally, the bipartisan bill that Senators Grassley and Klobuchar have introduced for each of the past several sessions of Congress, I think makes a lot of sense. And it's very similar to the bill that Senator Fernandez has introduced. I think it's really important to switch that presumption. When you have payment and you have delay, switch the presumption. Hey, drug companies, generics, if you really have a good reason for it, we'll listen to it. But the presumption should be that it's anti-competitive because one company is paying another to stay off the market. And so that shouldn't come into court with the default of this being okay. And so this is federal legislation that has a lot of support on both sides of the aisle. I think this is a bipartisan issue, has nothing to do with innovation or anything that drug companies always get upset about. And so that's where I see us being at the federal level.
Senator, Assembly Member, would you agree with that? That seems to be a bipartisan thrust on this.
Yeah, I would say so. I mean, from my colleagues on the other side, they have not necessarily opposed this bill. And I think everybody agrees that the prices are hurting all of our constituents. So to see the federal government take some action, I'm not going to lie, I'm kind of happy to see that there is some movement on here because some of the pushback that I've heard over the last 2 years of having these bills is that, oh, it's really a federal issue. You know, the state is going to be crazy. And like to Emily's point, yes, let's do the New York Health Act. So all of this is kind of, cleared up. But I'm interested and intrigued to see what is going on at the federal level to see if we really will see some changes.
And is there any conversation that you had in concert with the congressional delegation about what you and the Assembly member were working on and what's going on in Congress, the Senate?
Yes, there has been. I can't say like immediately recently, but they're very much aware of, this legislation. And I know many of us, if not all of us, have spoke on the issue at one point or another. So the awareness is there to see action. I believe that, everyone will be on board.
Thank you. Assembly member, did you have anything to add?
I think the senator really covered it, but yeah, this is something that we were seeing Lena Khan really ramp up, like this kind of oversight, and I think we've all been very concerned about what the future of the FTC and other kinds of watchdog groups, what's happening to them. But if we can see movement with this kind of bill in Congress, it does give a little bit of comfort. And I do feel like things are going to get worse on this end from the general feel of the economy. So I think it's really critical that we do see bills like this moving in Congress so that we can make sure that we're protecting all of our constituents.
Lee, I'd like to get your take as somebody who's been working on this for a number of years.
About 20 years now. And yes, paper delay in particular is an area that has received a lot of attention at the federal level for quite a while now. And ARP has consistently endorsed bills that have come up that would try to prohibit these types of agreements. And I do think it's safe to say there is a lot of interest, generally speaking, in kind of what I like to call shenanigans that happen within the prescription drug market. It's very hard to defend some of these anti-competitive practices. Pay for delay is just one of, unfortunately, a lot of different ways that brand name drug companies are trying to hold their monopolies for as long as possible. And all of those solutions have very strong bipartisan support. And given the complexity of the current political environment, those types of bipartisan solutions are kind of hard to come by, and they do attract a lot of attention. So I do very much foresee this continuing to be an issue because people recognize, even surveys of the public show, people recognize that this is a problem and it's something that should be addressed.
Okay, and Lee, as long as we're with you, I wanted to ask about coordination. ARP, it's a national organization. How are you working with the state ARPs on this issue with legislators? How do you guys get together on this?
There is a lot of collaboration happening behind the scenes. For those people who aren't familiar with AARP structure, we actually have offices in every state and territory, as well as that national office in Washington, D.C. And all of our offices work very closely together to make sure that we're all kind of thinking the same ways and working towards the same common goals. And state offices like AARP New York do just an incredible amount of work on a really wide variety of issues in trying to enact legislation that is going to benefit our members. Those state choices can be very different in terms of their politics, but a lot of times we see that same issue pop up in multiple places and in multiple ways. And so we work very closely and work very hard to make sure we're working closely to ensure that we're learning from one another, because oftentimes we may see a federal bill that may inform a state bill or vice versa. Oftentimes we see state ideas kind of bubble up to the federal level. So we often see a lot of different things in 50 different states. And so making sure that we're all looking at the same way and responding the same way is really important. On this issue in particular, though, AARP New York, I know, has been working really closely with state legislators to try to make progress and having events like this today. And they've been doing, there have been some similar activities at the federal level. So our involvement in these issues can be anywhere from like lobbying to running an awareness campaign to endorsing bills. I think it's just kind of reflective of the fact that AARP very much wants to make sure we're showing up for our members in a lot of different ways.
Thank you. Next, I'd like to ask the rest of the panel now about the advocates, the stakeholders that you've been working with or that you've seen coming to the forefront on this issue, both to end it and to extend it. And I'll open that up to the panel to get your thoughts on that.
I just want to say I appreciate the advocacy of AARP because, sometimes Albany and all the work here is almost in a bubble, and we know the faces that are in the fight with us, but it's always so comforting and, like re-energizing for me when I'm out in my district in any which corner, and, whether they know me or not, or we get into the conversation that they know me and it's a senior, I hear from my AARP and we need to reduce the drug prices. This is your bill, or like just telling me of the bill, not even knowing that I may be the sponsor, but the awareness gets far through the work of AARP. So I really do appreciate that because, as a legislator, the more that I hear from my constituents, the more it encourages me to stand on an issue. And this is one that continually comes up. A lot from the work of AARP, and then in addition to what we do here and how we try to get out, our actions to the community. So whatever we're doing is working. And, of course, I feel like we can just amp up every effort. But this is something that I think certainly stays with people and has been, becoming more in the know.
Yeah, I'd really like to, second what the senator said. AARP has been an incredible and critical partner. Everyone has a person that they know that has overpaid for a life-saving or a life-sustaining drug. And it's just not right that the top three drugs right now are over $60,000 for access to their for access to their life-saving abilities. So AARP has really taken this and brought it to life in the halls of Albany. And you know, as Senator Fernandez was saying, we are dealing with thousands of bills every year that are competing for our attention. So the more that seniors are bringing their personal stories and their personal concerns to us via organized lobbying, it's really, really useful. I also want to shout out the Attorney General's office, who's been working with us on this bill. In the bill, they would be given the role of the tracker. So they would be watching these deals. They would be looking into who is making these kind of agreements and holding them accountable, making that determination of you know, who we need to really emphasize. So we are all sharing this goal of protecting consumers, and I think it's the most important goal in a society where so many of us are struggling to survive and to make ends meet.
And I wanted to weigh in here to talk about the unique role that the states can play. So before we talked about the role of the FTC, I still think whatever happens with the FTC, the states still have a critical role to play. So let me just flesh it out a bit more. So the worst case scenario is one that we got a snippet of when the reconciliation bill for a few days had the FTC being swallowed up into the DOJ. In which case there's no FTC, there's no ability to bring any of these cases. And so that's the worst case scenario where there clearly is a role for the states. But even in the best case scenario from the FTC, there still is a vital role for the state. So what's the best case scenario? It is the FTC continuing to bring pay for delay cases. It's done this for the past 20 years, but it has limited resources. You might have heard that there may be some other industries, I don't know, maybe dealing with technology, that are occupying the FTC these days. And so at most, it will be one pay for delay litigation every 3 to 5 years. Even if that's the case, there's still a role for the states to play. And then finally, even if Congress passes legislation, that does not dispense with the need for New York to pass legislation. Why? Because even though there's overlap on the presumptive illegality, the federal legislation is limited to the FTC bringing a case under its Section 5 authority. It doesn't give authority to other entities like private parties. And so for that reason, even if Congress passes pay for delay legislation tomorrow, there still is a vital role to be played by New York legislation.
Professor, you mentioned the worst case scenario for the FTC, the best case scenario for the FTC. What do you see as the most likely scenario moving forward?
I think I'm an optimist by nature, and so I like to imagine that my field doesn't disappear overnight with the FTC being swallowed up. And again, the FTC played a crucial role. Go back 20 years when all the courts were saying no. The FTC has played a crucial role. So I would hope that they would still be around. Again, this is a bipartisan issue. And I can say that with a fair amount of confidence. I've testified to Congress a number of times. I've had Republican legislators co-sponsor bills based on my work, because this is going after the easy stuff. It's going after the low-hanging fruit where you are not touching innovation at all, but you're stopping the shenanigans, as we heard about before, as Scott Gottlieb, the chair of the commissioner of the FDA under the first Trump administration. These are shenanigans. These are games that drug companies play, and there are other things that could potentially affect innovation. Nothing that we haven't talked about on this entire call has anything to do with innovation. So my hope is that the FTC would continue to go after it, but it is such a big problem and unique to all of the issues with drug company delay is that a lot of the generics are the bad guys here too. The generics are settling with the brands. The generics are the ones that are coming out against this legislation. So don't question yourself when you say, oh, AAM is against this. AAM represents generics that do really well when brand firms pay them to not enter the market. And so this is a really big problem. You have the brands and many of the generics on the wrong side of the issue. Even the best case scenario with the FTC leaves a lot of work for the states like New York to do.
So I'd like to pick up on that thread, the work that needs to be done, and open this up to the panel as well. We saw some work, legislation from California to address this in 2019 that was recently overturned by a federal judge. They were California. I'll let the professor speak more to that. I was wondering, what are the lessons learned, Senator, for your legislation? What do you see that can be done going forward in the wake of that decision? Professor, I'll start with you. Oh, sorry, go ahead, Senator.
No, I mean, I think we still keep banging the drum, as it was mentioned here. New York can still set our standards firm about how we operate and do this business. So, I feel like there's been blips of hope in the governor's executive budget. I think she put in a version of this bill. So there is awareness, there is a want to do it. I think just figuring it out is the concern with a lot of things. I've spoken with Department of Finance as well, and there is a want to see this happen, belief that they can litigate well if given the chance. So, we're just going to continue pushing and continue to speak to the executive, to the varying partners that, would have a say. Of course, there's opposition that is also speaking to the executive and varying partners. So we just got to keep countering that.
Thank you. Lee, did you want to weigh in on that?
Yeah, I think, specific to what's being discussed today, as a policy person, I don't know how to create good policies without understanding exactly what I'm dealing with. And that's why transparency is so, so important. It is really difficult for me to be able to come up with an effective solution if I don't have the universe in front of me of the problem that I'm trying to solve. And that's what I think is so appealing to the approach that's been discussed today, is that will give people like me the ammunition I need to come up with the solutions that will actually work. The reality is, we get bits and pieces from FTC. They see these agreements, they see what's happening, and we get glimmers from them about, oh, they're like what Michael mentioned, they're shifting their tactics, things are, changing, they're compensating in different ways, but we don't know for sure. And so that, to me, I think is just so, so important as we're trying to address this problem, is really fully understanding what we're dealing with.
And so I agree on the transparency point. Anything that New York passes along the lines of transparency is different than what California did with their AB 824. And so I don't think there's anything to worry about there. Even in terms of Senator Fernandez's bill, I don't think California should slow you down. For starters, California didn't address the preemption issue or find that that was an issue. Why? Because this is not about the patent merits. This has nothing to do with the federal patent system. Rather, it is an antitrust violation. If you look at what California argued in that case, it made more sense than the district court's ruling on the Dormant Commerce Clause, because AB 824 was not changing the scope of state law. And then finally, you could imagine legislation that would be limited to settlements involving sales of the drugs in New York. And so that was one of the things that the judge seemed to get worried about. If you limit it to sales in New York, then there's a clear connection to New York.
Interesting. I wanted to talk a little bit about critical mass. Do you feel, and again, this is for the panel, do you feel that you're hearing more from the stakeholders, more from the citizens most impacted by this? And do you feel that there's more going on now that could lead to a more positive outcome for this kind of legislation? And why?
Yeah, I am seeing some real forward momentum this year with this bill. And, the only opposition that I've heard about is from Big Pharma themselves, which to me says that they know that we're onto them. So I think that's a good thing. We have to fight behind closed doors for who's going to come out as the victor on this, but I do think that, you know, the momentum is there, and I think that we need to keep up the pressure and keep up the conversation, because this is one of those dirty little tricks that people don't even know is happening. So the more that we can spread the word that this is happening and we can resolve it, that's a really important piece of being a legislator and of the work that we do in New York State. So I'm really looking forward to this bill passing.
I can also speak to our members. You know, part of the reason that ARP is so engaged on this issue is because we hear from them about what they're facing when it comes to prescription drug costs. And a lot of times they will say, you know, this drug has been on the market for 15 years. When am I going to get a generic? And then you start telling them about what's happening behind the scenes, and then they get even more upset. So I do think there is a level of awareness that's needed. People understand the drugs are too expensive. They understand that they don't have access to a generic, and they don't understand why. And helping them see what's happening and that there's something that can be done about it is incredibly important and helps, you know, get them very engaged. So I would say, you know, like I mentioned previously, when it comes to surveys, once people are aware of what's happening, once they're aware these agreements are taking place and what's happening to them because of those agreements, the support for it is incredibly, incredibly high, you know, 80–90% when you look at surveys, to trying to do something about these agreements. So I think the awareness is important. And again, once people understand what's happening, they tend to be very supportive of efforts to do something about it.
And I wanted to say something about the opposition that we've heard to some of these bills. On its face, initially, it might make sense, but just probe it, think about it for a few seconds, and you'll see that it's just scaremongering. So just three things that Pharma has said in opposition to A2289 and S488. First is that there won't be any settlements, that patent settlements are an expected result of the framework. This is all a good thing. We're not talking about just settlements here. We're talking about settlements with payment. So every time you hear, oh, there are going to be no more settlements, recognize there will be plenty of settlements. The FTC's annual reports show that the number of settlements increased after activists. It's just the number involving pay for delay went down. So that's the first thing that's wrong. The second thing that's wrong is when they say there's going to be entry before the patent expires. We haven't even talked about the fact that there are many patents here. Typically, the settlement is not on the active ingredient. But even so, you can't say just because there's entry before the patent expires, that's a good thing. That is the scope of the patent test that the Supreme Court rejected in activists. Because what happens is the brand pays the generic to go away. Let's say it's a bad patent. A lot of these patents are on parts that are trivial to the drug. You never get to actually litigate the patent. And so that's the second thing that's wrong. And the third is a sleight of hand, where they say, oh, there's no reason for the state to do anything because the FTC is acting. By the time they get to the FTC, they say there's no reason for you to do anything. And they've done this before. They do it when it comes to legislation. They say, Congress, there's no need to act because the courts have it. But then they go to the courts and say, oh, what we're doing is completely fine. So just watch the sleight of hand where they're saying no need to do anything here because look over here. And then the last thing I'll say is just repeating something I said before. Oftentimes I talk to the media and they say, well, AAM and the generics lobby, they have a problem with this legislation. And I had to explain so many times that AAM does not represent the consumer here that I wound up writing an article on it to show how AAM is in bed with the brand firms when they are representing really large generic companies who do really well. If I'm a large generic and I'm getting paid tens or even hundreds of millions of dollars to sit on my hands and not enter the market, I'm going to love these settlements. If you look at ABA 24 in California, at the end of the day, pharma backed down and did not challenge it. AAM is the entity that is still challenging it. AAM, the generics group, is the one that is going to go after all this stuff. So just keep that in mind when you try to think about who's representing the consumer.
Fascinating. And you actually took my next question, which was what is the position of the drug companies when you ask them about this? Thank you for that. So my last question before we open it up to the audience, what are the what's next? What are the most likely, most achievable next steps in the process, both short term and long term?
Short term, we have a month of session left, basically. Every day we're going to see that our bills can move, have the discussions that we need to with committee chairs and members, and of course, everyone that needs to be involved to see that we can pass both houses. I think I've passed this before in the Assembly. I'm sorry, in the Senate. So any way that I can be helpful to see it pass in the Assembly, after the Senate, is where efforts will be. So just making sure that we can take every day as a tool to keep moving forward.
Yep, and in the Assembly, we're making some really good traction in committee towards passage. So, I think continuing to reach out to your representative, tell them how important it is to make pay for delay transparent so that we can see clearly what is happening here and then move to change it. That is a really, really important thing. I cannot undersell or I cannot oversell how important it is for you to be reaching out as individuals and letting your reps know that this really matters to you.
Assemblymember Gallagher, I just wanted to follow up on that. Have you seen an increase over the years in the number of people reaching out to you? I know that there's like the cost of prescription drugs is far outstripped normal inflationary pricing. I'm just wondering, has that tracked with your office?
Yes, and especially as we are seeing other critical functions of daily life get more expensive. For example, utility companies, rent. Many of the seniors in my district are really struggling to get their basic necessities met. And the great thing about working with AARP is that these are really educated consumers because they're a part of this organization where they're really able to find out exactly what is going on, and that there is a role for the government to play. So I have been hearing from my constituents, and I've also been hearing from other people's constituents who have reached out via email thanking me for carrying the bill. So I think that it's a really important bill. It's one of those little tiny bills that people don't always hear about, but is so important and is really going to change the conversation around medicine and around health.
Thank you. Lee, what's on AARP's punch list?
Well, I don't want to speak too much for AARP New York, but I do work very closely with them. So I think it's safe to say that they will continue to be heavily engaged on this issue going forward. And at the federal level, I do anticipate that AARP is going to continue doing all the work it's doing around prescription drug affordability, and pay for delay is just one part of that. Continuing to ensure that Congress is aware of all the different challenges that are out there and how pay for delay can help address one of those challenges, and also making sure that they're aware that this truly is a bipartisan issue, and it is an issue that affects all Americans, not just the people that AARP represents, and that moving towards some form of progress is an incredibly important thing to have, particularly in an environment when, yes, this has been mentioned repeatedly, everything is getting significantly more expensive.
Yeah, you bring up a great point. I mean, the work that's being talked about now would impact every American who takes a prescription drug. And have you seen any kind of alliances, either nascent or already existing or planned from other groups that this kind of legislation would impact, wanting to work with you?
I would say, it's very comparable to when we are making sure our members are familiar with what pay for delay agreements are and how they're impacting them. The same thing kind of applies to a lot of different groups that work on issues around affordability specific to healthcare. There are a good number of groups that are particularly focused on prescription drug affordability, and those groups are very well aware of exactly what's happening and the kind of this anti-competitive practices that we've been trying to find ways to fix. And so pay for delay, I think, is going to continue being part of those conversations. And to the extent that that tent can be expanded to include those other groups that are generally interested in healthcare affordability, that sort of work is going to continue as well.
Thank you. And Professor, what are you paying most attention to on the horizon?
So I think all of the above. I think it is really important at a time when we seem to be drifting apart at the seams to just appreciate how bipartisan action on pay for delay is. I mean, go up to someone on the street and say, I'm going to pay you not to enter the market. People would say that's crazy. Nonetheless, it goes on and it happens. And the drug companies hide behind their arguments on patents and settlements. And it's tough to dismiss them right off the bat, but they're actually wrong. And as we've talked about this entire hour, people's lives are at stake. This has nothing to do with innovation. This has nothing to do with legitimate reasons for settlements. This has everything to do with brands and generics doing well, all at the cost of consumers not being able to afford their medication. And that's why it is so important to pass the legislation that we've talked about today.
That's a great nutshell. Thank you. Got a couple questions from the audience here. The first one addresses the Grassley bill. That's from Senator Charles Grassley in the U.S. Senate that we discussed earlier. The question is, does the Grassley bill address the non-cash consideration for delay?
Yeah, it refers, like Senator Fernandez's bill, to anything of value. So that is a good thing, and it expands the universe just beyond cash. I'm pretty sure it includes exclusive licenses too, that Senator Fernandez's bill includes, because sometimes the companies will say it's just a license. What's wrong with a license? But that could be a way to hide payment. And so it is an expansive determination of payment.
Okay. Our next question comes from an active AARP advocacy volunteer. They want to know if anybody has suggestions as to what local government might be able to do to promote this effort to lower drug prices and bring pay to delay to an end that we haven't already discussed.
Yeah, say local government as in our level or more
Yes.
local? Oh, all right. Well, I mean, in this local, the legislature, we're doing what we're doing, the bills that we have, trying to see them, move forward. As far as like a lower local effort, sorry, I can't get into that detail. Never worked in that area. But yeah,
I
we're
would
doing what we
say,
can.
sorry to interrupt you, Senator. I didn't mean to. I would say, if you have a passionate group of people in your city or town, ask your local municipality to pass a resolution supporting the bill. And that can really, signal to the leadership that this is something that is not only being talked about at the state level, it's being talked about at the local level too. So passing resolutions, having letters written by your closest representatives, that always has a little bit of a little extra push to the state level.
Lee, anything to add to that?
Yeah, I think anything that can be done at the local level to really raise awareness, one, that this issue exists, and that two, there are efforts at the state level to do something about it. I think it's been mentioned a few times, having engaged community members reaching out to their policymakers is incredibly effective. And so to the extent that anyone can contribute to making more people aware of what is happening and how they can help, I think would go a long way.
Okay, and our last question is one that I actually wanted to ask. It's, can the USA ever model its pharmaceutical industry on what is being done in Canada? And I guess we could expand that to any other country model examples.
So I can jump in on that, I guess.
Go ahead.
That is an incredibly big question. There are a lot of differences between the United States and other countries in terms of how we deliver healthcare coverage. We have a very fragmented healthcare system. And so unlike other countries that have a single entity, which is the country itself, kind of negotiating drug prices the way on behalf of all of their country members, the United States has a lot of different groups that are doing that type of negotiation and working with drug companies at a much more small level. So that makes it challenging for us to really replicate what's happening in other countries right now. We are seeing some really great efforts. A really good example of kind of how the US is making progress towards maybe that larger negotiation, of course, is what happened in a 2022 law that passed called the Inflation Reduction Act that included a provision that allows Medicare to negotiate on behalf of people who are in the program. And that is a scale of negotiation we've never seen before. And to me, that's a signal that we could be moving in more positive directions where we could potentially have a better handle on prescription drug prices than we do right now. But there obviously is more work to be done.
Anyone else from the panel want to add that maybe there's something that could be cribbed from another country's P&P?
Well, I
No?
said it before, but I'll say it again. You know, the best way that we can fix healthcare in the United States is by removing the profit incentive altogether and making it a recognized human right, and socializing it through the means like we see in Canada or in the UK or in other countries. And there is an opportunity to do that in New York State with the New York Health Act, and that's really that's going to help us move the conversation forward. We're kind of stuck in making deals and pitches with people who are here to profit off of our illness, and that's got to stop.
All right, and I would just like to close by thanking our panelists again, State Senator Fernandez, Assemblymember Gallagher, Professor Carrier, and Lee Purvis. It's been a great honor to speak with you today. And that concludes our panel.
Thank you so much. Great
Thank you.
conversation.
This was a lot of fun.
Thanks so much. Bye-bye.
Goodbye.